I survived endocarditis twice. Most people have probably never even heard of that. If you haven't seen my videos before, my name is Jim, and usually I talk about thoracic outlet syndrome, and most people usually haven't heard of that either. So I seem to always get all these weird things. So the reason that I'm bringing this up right now is endocarditis is a heart condition, and usually I see a cardiologist like twice a year, but I moved last year, and so I haven't actually got a new cardiologist since I moved. So my second wife, who actually lives about 10 minutes from me, she was with me the first time I got endocarditis, and so she knows how it is, and she's always bugging me. Have you seen the cardiologist lately? I'm like, no, and she kept bugging me. You need to make an appointment. You need to get in there. You need to get in there. So finally I did. So last week I had an echocardiogram done. They usually do it like once a year or so since I had the surgery. Surgery was 12 years ago now. But anyway, I see the doctor on Monday, and this is a new doctor I just picked out randomly off the internet, mainly because he was pretty close to me, one of the closer ones, and it was an easy location to get to. So he comes walking into the room and he says, "I know you." And I'm thinking, how do you know me? And he's like, and he started telling me the story. He goes, "You're the guy who had endocarditis twice. You had it like prior time, like 10 years before, and then for some reason it came back again, and that time it ate up your heart valve and you had to have surgery, because I was working with your doctor at the hospital at that time." So I thought that was pretty interesting. Out of all the doctors I picked, that this was a guy who actually knew who I was, that was working with my doctor. So he was kind of asking me, he goes, how did you get it the second time? I'm like, I really don't know. And like, I don't know how I got it the first time either, because with endocarditis, what happens is you get like bacteria in your bloodstream, I guess, and then it attaches to your heart, and it damages your heart. And like in my case, the second time it ate up my heart valve. The first time it didn't do too much damage, but the second time it ate up my heart valve, and I had to have it replaced, and they put in a pig valve. But it's really hard to diagnose, and it's kind of like you have the flu. You like just feel really tired all the time, really run down. All I'd want to do is lay in bed. And like I said, my second wife, I was with her at the time, and she experienced it, and it's like, it was really hard to get diagnosed. They accuse you of, doing intravenous drugs all the time, because I guess that's one of the big ways that you get it, is injecting yourself with needles. But in my case, they really did never figure out, why I got it. They say sometimes you can get it around your gums if you I guess don't take good care of your gums and things like that, but I really don't know. But like I said, it's really, really tough to recover from. You're really tired all the time, and they have to put you on intravenous antibiotics, and you have to be on them for 6 weeks or 2 months, something like that. They have to put a PICC line in your arm, and it runs way up to near your heart, and you just have an IV that feeds the antibiotics into your system just throughout the day. So the second time I had it, I was really run down, really tired all the time. Actually, I went to the doctor, my family doctor, and he looked at me and said, "Oh, I just think you have a virus that's going around, whatever." So nothing. It's like I said, it's hard to diagnose. They had a hard time diagnosing it the first time as well. So then maybe about a week later, I still wasn't doing good, and my wife that's the wife that died, that was with me at that time, and she was like, you're really pale looking, and you're not even talking quite right and stuff. She said, "I'm taking you back to the doctor." So she kind of drugged me back to the doctor, same doctor, my family doctor, and he started looking. He goes, "Yeah, you look like you're really pale," and he started doing looking like at my eyelids and stuff. He goes like, you look like you're losing blood or something. And he says, maybe we should check you. This was on a Friday. He says, maybe we should check you into the hospital on Monday if you're still not doing good. And my wife's like, no, he needs to go now. So the doctor like said, okay. So anyway, they checked me, you know, into the hospital, and you know, started doing all these tests, wondering why I was losing blood. I actually had to have blood transfusion a time or two. I felt awful, and I remember like finally all these doctors kind of working together, and this one doctor comes in and goes, remember when you had endocarditis before? I'm like, yeah. He goes, it's back. And I remember I was just like devastated, because I remembered how hard it was to recover the first time. And you know, I remember just crying and telling my wife, I said, because they said, you know, you're gonna have to be on, it ate up your heart valve, and it's like you're gonna have to be on antibiotics for like, you know, a week or two before you're in good enough shape to have surgery, because right now the tissue around your heart is so soft, and that if we do surgery, the stitching and stuff may not hold, the heart valve may not stay attached. But I remember just like crying and telling my wife, said, you know, I can't make it for, you know, another week or 10 days or however long they think. I said, I feel awful. I said, I don't think I'm gonna make it that long. And later on, when it was all over and I was okay later on, actually a couple of my friends came and visited me in the hospital, and she told me later, she goes, I thought you were gonna die, so I called your friends and told them they better go visit you. So somehow I made it through all that. I have no idea why. So that's like 2 times I had that. So like that's 2 times that, you know, I looked up endocarditis. It says left untreated always results in death. So that's 2 times that I could have died. The second time I thought I was going to die for sure. I mean, I felt awful. But back to the doctor visit on Monday, the doctor said, well, the echocardiogram looks pretty good. He said that valve that's replaced looks pretty good. He said there's a little bit of something around it. It may be cholesterol, so he wants me to be taking cholesterol pills again. I'm not too big on that, but he's like, well, we can do some tests and look at all that, and then if it is, then you're still gonna have to take cholesterol pills anyway, and it's gonna cost you a bunch of money. I'm like, so like, okay, well, I guess it's easier just to take the pills. And he just like laughed and said, yeah. So anyway, that's where I'm at. They replaced it with the pig valve. He said a pig valve usually lasts about, I don't know, 10 or 15 years, so we're at the 12-year mark now, and I don't know, I'm doing okay for now, so I guess they just keep, he wants me to come back every 6 months. That's kind of how it was before with my other cardiologist. I guess my other guy retired anyway since I moved. So anyway, that's the story on that. If you have any questions, leave them in the comments. Thanks for watching. See you guys next time.